I am here with Josie Alston and Caroline Murray from the University of Mississippi Medical Center. How are you both doing today? How has ASHA been?
Doing great. ASHA's been
wonderful.
It's been a great 3 days.
Mm-hmm.
Anything in particular this year in comparison to last year that's stuck out to you with ASHA?
We feel like there has been a more or higher increase in presentations on head and neck, which is really exciting compared to last year and previous years. So there's been more content for other therapists that are out there trying to learn more about head and neck, which is exciting. So we feel like this specialty area is growing, and clinicians are more excited or interested in learning more about it so we can better treat these patients. So that's been an exciting thing that we've seen.
And I think that's going to be necessary because
Definitely.
The research shows that head and neck is just going to increase
absolutely
exponentially in the next 10 years. And so just really kind of to stay up on top of the topic has been interesting.
Yeah, and having a good foundation for it. Because I think a lot of people, too, get maybe one random head and neck patient like once or twice a year. And so that will slowly start increasing, too, as we see more of that coming. But having just a better foundation. So it's nice that ASHA has seen that and then let more presentations in on head and neck. So it's wonderful.
You know, it's great for networking. We get to meet a lot of other head and neck
that's a good point.
providers and kind of toss ideas off of each other. So I really enjoy that aspect of it, too.
Yeah.
Yeah, I've noticed that this year in comparison to other years, too, which is really exciting for us as head and neck clinicians. Now, I know you two just did a presentation. Could you tell us a little bit about your presentation?
Sure. We just did about an hour talk, a little bit over an hour, on reframing and rethinking total laryngectomy care for the patient and the provider, just kind of to go with the theme of this year's ASHA. And we really just wanted to share with other providers that see head and neck patients new ideas, novel ideas for educating residents or nurses or frontline staff, maybe your nurse practitioners that you work with, but also new ideas to help the patients feel more engaged with their health care choices and goals. And just seeing, we know the literature supports that the more education you give, the better outcomes you're going to have. So how do we bring that down to a clinical level? And that's really what we wanted to kind of get across, some ideas that we do at our university and really open up the floor and find out what others are doing.
Yeah.
Healthcare changes so much, so rapidly that, 3 years ago, I would not have expected my patient to be able to download a QR code.
Right.
But, time is a-changing, and, they're just much more capable of doing FaceTime for telehealth visits. They're much more capable of going to a website and watching a video, and it really has changed how we educate our patients.
Yeah, I really liked how you used QR codes. That was really cool in your presentation. I think a great way to make videos so accessible for patients to review at home.
Yeah.
And it saves it straight to their phone so they can watch it over and over. They can show it to their family.
Other providers,
medical
providers.
Right. They don't have a folder that's at somebody's house that has all the information. It's just an easier way to access information. And, we may have to help them right at first get it on their phone. But once they have it and they know how to find it, it's much better for them.
We also kind of looked at how to educate providers, too, because that was where we were seeing a lot of gaps. So educating the residents has been a really big thing that we focused on, and also the APPs, nurses, and other professions that work directly with the patients along their journey. So we feel like educating the patient more and then also the provider is really where we need to focus and continue focusing our education and keep doing these novel things like QR codes, videos, training our residents to take TEPs out, different things like that. So,
and one thing that we hope some people could take home from the talk was that there are a lot of educational tools out there that you can use, whether it be when you're interviewing your patient, the Ask Me 3 or the Educate tool or small learning groups. They're all so effective in helping you really kind of make sure that the patient is understanding the information that you're giving them.
Yep.
Yeah, that's really great, and a really great, well-rounded approach to patient and, like you said, provider education.
Right.
I agree.
Were there any other talks in particular you went to over this week that you'd like to share with us that you found particularly interesting and might bring ideas back to your clinical practice?
Absolutely. I really enjoyed the group of head and neck cancer providers from Florida. They were from several universities, but they did a grand rounds on the head and neck cancer patient with recurrence. And they called it "It's Back" because it does happen, and as you work years and years with these patients, and the last thing you want is for your patient's cancer to come back. But when it does, knowing how to address it and kind of quit focusing on the cancer, but focus more on the patient and say, what are you goals? What are you goals? Maybe you're not going to have perfect swallowing, and what do you want to swallow? What can we work towards that is going to make what's left for you enjoyable, and really kind of take those important decisions into consideration. And they had some case presentations, and it was just very well presented. And the group from Miami and Moffitt and Tampa, they were all great.
Yeah, that's really great, especially in those difficult cases of recurrence. But again, going back to a patient-centered approach and keeping their goals at the forefront.
Yeah.
Well, thank you both for taking the time to talk with us today.
Yeah,
it's been great. And I hope you
Thanks
have
for having us.
safe travels back.
Yeah.
Yes.
We'll see you at the
You
next
too.
ASHA.
Yes, thank you.